Imagine this. It is a Tuesday morning. You sit down at your kitchen table with a cup of coffee. You open your bank app to check if your Social Security payment arrived, and it is not there. So you pick up the phone, you dial the Social Security toll-free number, and you wait. 10 minutes, 30 minutes, 1 hour, an hour, and 39 minutes. That was the real average wait time last year, documented by AARP. Then the line goes dead. A pre-recorded message, call disconnected. So you decide to drive to your local Social Security office. And when you get there, the sign on the door says, by appointment only. You try to make an appointment, and you are told the earliest available slot is more than 4 weeks away. Now your rent is due, your prescriptions are due, and you have no idea where your money is. This is not a made-up scenario. This is what thousands of American seniors experience in 2025. And if you do not take 3 specific steps, it could happen to you. I am Elena, and I help seniors and retirees understand the real rules behind Social Security, Medicare, pensions, and retirement finance. Not the rumors, not the panic headlines, the actual government-verified facts. And today, I need to walk you through something urgent. There are 3 things happening right now in 2026 that every single person who receives Social Security or plans to receive it needs to understand. Number 1, Social Security offices have lost thousands of workers, and getting help in person has become extremely difficult. Number 2, the phone system went through a crisis, and while improvements have been reported, reaching a live person is still not guaranteed. Number 3, the official Social Security Trust Fund is now projected to run short in as little as 6 years, and if Congress does not act, your check could be reduced by 23 to 28%, automatically, by law. But here's the part most people get wrong, and this is why you need to stay until the end of this video. There is one mistake that 36% of Americans say they are about to make because of this news, and that mistake could cost them tens of thousands of dollars over their lifetime. I am going to show you exactly what that mistake is, and I am going to give you 3 steps to protect yourself. Every fact in this video comes directly from SSA.gov, the Congressional Budget Office, AARP, and the Kaiser Family Foundation. No rumors, no guesswork. Let us start with a story. Robert is 67 years old. He lives in a small town in Missouri. He worked for 38 years as an electrician, paid into Social Security his entire career. He retired in 2024, and his monthly benefit was $2,015. Robert did most things right. He waited until his full retirement age to claim. He had his benefits deposited directly into his bank account. He was careful with his money. But then, early in 2025, Robert's local bank was acquired by a larger bank. His account number changed. He needed to update his direct deposit information with Social Security. He picked up the phone, and he could not get through. He tried for 3 days straight. At one point, he was on hold for nearly 2 hours before the call dropped. So Robert drove to his Social Security field office, the one in Nevada, Missouri. But Robert did not know that more than half the staff at that office had just left through the government's voluntary separation program. The office was backed up. He was told he needed an appointment. The earliest one available was 5 weeks out. Robert did not have a My Social Security online account. He had never set one up. He did not know about Logan.gov or ID.me. He did not know about the new one-time PIN system. Without an online account, the only way to change his direct deposit was in person. For 6 weeks, Robert's Social Security payments went to a closed bank account. 2 full monthly payments, over $4,000, were returned to the Treasury. Robert eventually got it sorted out, but for 6 weeks, he had no income. He missed a utility payment. He had to borrow money from his daughter. And here is what I need you to understand. Robert did not do anything wrong. He was a responsible retiree who simply did not know that the system around him had changed. The rules for how you prove your identity with Social Security changed in April 2025. The staffing at his local office collapsed. And he was caught in the middle. Robert's story is exactly why I am making this video. Because what happened to Robert does not have to happen to you. But only if you understand what is really going on. Let me break down the facts. Let me start with the truth about Social Security offices, because accuracy matters. On March 27, 2025, the Social Security Administration put out an official press release. The title was, quote, "Correcting the Record About Social Security Office Closings." In that statement, the SSA said, and I quote, Since January 1st, 2025, the agency has not permanently closed or announced the permanent closure of any local field office. So no, Social Security offices are not being permanently shut down in a mass wave. That specific claim is not accurate, but, and this is a very important but, here is what did happen. The SSA cut approximately 7,000 jobs, reducing its workforce from 57,000 to a target of 50,000. That is a 12% reduction. And according to AARP, nearly 80% of the 2,500 workers who took voluntary buyouts came directly from field offices, the offices that serve you in person. 40 offices across the country lost more than a quarter of their staff. 11 lost more than a third. 3 offices in Wisconsin Rapids, Wisconsin, Nevada, Missouri, and Alexandria, Minnesota, lost more than half their workers. And in January 2025, the SSA began requiring that you make an appointment before visiting for most services, including applying for benefits. You cannot simply walk in anymore for most things. The SSA also announced plans to cut foot traffic to field offices by 50%, shifting services online and to the phone, so the offices are technically still open. But for many seniors, especially those in rural areas, or those who are not comfortable with technology, the practical access to in-person help has been severely reduced. That is the honest truth. Not fully closed, but much, much harder to reach. Now let me talk about the phones. The SSA's own performance dashboard, updated on April 10, 2026, shows that the national 800 number had an average wait time of 7 minutes in March 2026, with an 83% answer rate. That is a significant improvement. But let me tell you what happened before that. In March 2025, AARP documented that the average wait to speak to a live representative was 1 hour and 39 minutes. If you chose the callback option, it was 2 hours. And 28% of callers were simply disconnected with a pre-recorded message. That means almost 1 in 3 callers could not get through at all. The situation was so severe that Senator Warren formally asked the SSA's Inspector General to audit the phone wait times. Now, the SSA says things have improved, and based on their published numbers, it does appear that way. But here's what I want you to take away from this. Systems can change rapidly. The phone lines were fine in 2024. They collapsed in early 2025. They appear better now. You cannot afford to depend on any single method of reaching Social Security. You need a backup, and I am going to tell you exactly what that backup is in the action plan. Now let us talk about the trust fund. This is the big one. And I need you to listen carefully, because this is where the most dangerous misconceptions live. The Social Security Administration's own 2025 Trustees Report, published on June 18, 2025, states that the Old Age and Survivors Insurance Trust Fund, that is the fund that pays retirement and survivor benefits, is projected to be depleted in 2033. At that point, incoming payroll taxes would only cover 77% of scheduled benefits. That is a 23% cut. The Congressional Budget Office, in their February 2026 report, moved that date up by 1 year. They project depletion in 2032 with benefits reduced by up to 28%. And here is something that made the timeline even worse. The new $6,000 senior tax deduction that was passed as part of the One Big Beautiful Bill, while it does help seniors on their taxes right now, the SSA's own chief actuary calculated that it will cost Social Security $168.6 billion in lost tax revenue over the next decade and accelerate the trust fund depletion from early 2033 to late 2032. Now, here is where I need to correct the single biggest myth I see in every comment section on every video about this topic. Social Security will not stop. It will not go to zero. It will not disappear. Even after the trust fund is depleted, approximately 185 million American workers are still paying payroll taxes into the system every single paycheck. That money keeps flowing in. The SSA itself has stated, quote, even if Congress allowed trust fund reserves to become depleted, the large majority of scheduled benefits would still be payable on time. What would happen is a reduction, not an elimination. You would still receive a check, but it would be roughly 23 to 28% smaller unless Congress acts before then. For the average retiree receiving $2,071 a month in 2026, that could mean a reduction of $476 to $580 per month. That is real money. That is groceries. That is medication. That is a utility bill. And this is the critical mistake I warned you about at the beginning. A 2025 survey by Schroders found that 36% of people who have not yet claimed Social Security say they plan to file before age 67. And the second most common reason, cited by 36%, was fear that Social Security will run out of money. Here is why that is a trap. If you claim at age 62, you lock in a permanent 30% reduction in your monthly benefit compared to your full retirement age. Permanent for the rest of your life. But if you wait until age 70, you receive 132% of your full benefit. That is 76% more than the age 62 amount every single month for the rest of your life. So claiming early out of panic in order to get your money before it runs out actually guarantees that you will receive less money forever. Even if a 23% cut eventually happens, the person who waited until 70 is still receiving a larger check than the person who panicked and claimed at 62. The only exceptions are if your health makes it unlikely you will live into your late 70s, or if you genuinely cannot meet basic expenses without the income. Those are valid reasons. Fear of the program disappearing is not because the program is not disappearing. One more thing before the action plan. Many of you heard that Social Security benefits went up 2.8% for 2026. And they did. That added about $56 a month to the average retirement check. But the Medicare Part B premium also went up from $185 to $202.90 a month. That is a 9.7% increase. And since that premium is deducted directly from your Social Security payment, the actual net increase most of you felt was about $38 a month. And according to the Kaiser Family Foundation, more than 7 million Medicare beneficiaries are already spending 10% or more of their annual income on Part B premiums alone, before we even talk about Part D, Medigap, copays, or prescriptions. So when you hear COLA increase, please understand, it does not mean your purchasing power went up. For many of you, it went down. All right, you now understand the real situation. Not the panic version, not the denial version, the verified, documented truth. Here are 3 specific actions you should take. And I am not being dramatic when I say this, the sooner you do these, the better protected you are. Step 1. Set up your My Social Security account today. Go to ssa.gov My Account. Create your personal My Social Security account using login.gov or id.me. This is now the most important tool you have. With this account, you can check your benefit amount, change your direct deposit information, download your SSA 1099 tax form, get benefit verification letters, check the status of any pending claim, and generate a one-time PIN at ssa.gov /PIN so you can make changes over the phone. Once you have this account, you do not need to prove your identity again for online services. The SSA confirmed this directly on their website. And most importantly, if you ever need to change your bank or direct deposit, which is exactly what happened to Robert, you can do it online instantly without waiting 5 weeks for an in-person appointment. If you are not comfortable with technology, please ask a trusted family member or friend to help you set this up. Do it this week. Step 2. Do not claim Social Security early out of fear. If you are between 55 and 69, and have not yet filed for Social Security, please do not rush to claim because of scary headlines. The Social Security Administration's own data shows that waiting to claim means a bigger check every single month for the rest of your life. The difference between claiming at 62 and claiming at 70 is 76% more income per month. Talk to a trusted financial advisor or use the SSA's own retirement estimator at ssa.gov before making this decision. Factor in your health, your savings, your spouse's benefits, and your other income sources. Fear is not a financial plan, and the math, even accounting for a possible future cut, still favors patience for most people. Step 3. Review your Medicare coverage every single year. Your Medicare Part B premium just went up nearly 10%. Your Medicare Advantage plan may have changed its out-of-pocket maximums, its drug formulary, or its provider network. Every year during open enrollment, from October 15 to December 7, you have the right to review and switch your plan. Do not auto-renew without looking, and if your income is limited, look into Medicare savings programs. These are state programs that can help pay your Medicare premiums, deductibles, and coinsurance. Many people who qualify do not know they exist. You can check eligibility at medicare.gov or by calling 1-800-MEDICARE. Also, if you are 65 or older, make sure you or your tax preparer knows about the new $6,000 senior tax deduction. It is available for the 2025 through 2028 tax years. For individuals with income up to $75,000 or married couples up to $150,000, you can claim the full deduction. It will not solve everything, but it can put real money back in your pocket. Before I let you go, I need to tell you something important. The rules around Social Security, Medicare, pensions, and banking are changing faster than they have in decades. What is true today may shift in 6 months, and the systems you depend on, the offices, the phone lines, the websites, they are under enormous strain. You cannot afford to be surprised by these changes. And I have to be honest with you. YouTube might not always show you my next video. The algorithm decides what you see. Notifications get buried, videos get delayed. That is why I created something specifically for you. In the description below this video, you will find a link to join the Global Senior Alerts Official WhatsApp channel. This is a free channel where I send real-time alerts whenever there is a major change to Social Security rules, Medicare policies, pension laws, banking regulations, or travel rules that affect seniors. When you join, you can also download a free copy of the Senior Benefits Protection Guide. It is a simple step-by-step document that walks you through how to set up your My Social Security account, how to protect your direct deposit, how to check your Medicare plan, and what your legal rights are if a debt collector ever tries to garnish your Social Security income, all based on official government sources. This is not about selling you anything. This is about making sure you are never caught off guard like Robert was. You worked your entire life for these benefits. You paid into the system with every single paycheck, and you deserve to understand exactly how it works, what is changing, and what you can do about it. Do not let fear make your decisions for you. Let the facts guide you. Set up your account, review your Medicare, and make your claiming decision based on your life, not on a headline. If this video helped you, please share it with someone you care about, your spouse, your neighbor, your friend, at church. Because the person who needs this information the most is often the person who does not know where to find it. I am Milena, and I will see you in the next one.